India has the largest burden of tuberculosis and drug-resistant tuberculosis in the world. Nearly 1,400 people die due to TB every day. TB is the most important public health challenge that the country faces today. In addition to the public health sector, there is a large and diverse private health sector where more than 60% of TB patients first seek care. Patients see multiple providers, which leads to a delay in diagnosis. This could lead to the worsening of the disease, increased transmission of TB, increased out-of-pocket payments for the patient, and lost work time with devastating consequences. The Private Sector Engagement Initiative, which was implemented in Chennai, India, demonstrates a sustainable model for private sector engagement in providing standardized TB care to encourage private providers to use state-of-the-art diagnostics for their patients with TB symptoms, promote the use of standardized TB treatment regimens with quality-assured drugs, and provide coordinated support for private sector patients to improve treatment success. Here's how the initiative works. A private practitioner is first sensitized on the standard procedures for diagnosis, treatment of TB, and the services available free of cost for their patients. A private practitioner's kit contains reference materials like standards of tuberculosis care in India, and referral coupons are given to them. When a patient first comes to a private practitioner's clinic, their vitals such as height, weight, temperature and blood pressure are measured and noted before the nurse takes them to the doctor. The private practitioner takes the history of illness, questioning them on the duration of symptoms. If the private practitioner considers a differential diagnosis of TB, he refers the patient for diagnostic tests. The private practitioner then uses the referral coupons given to them to request an X-ray and a gene expert for the patient, which is available free of cost. Once the patient returns with the reports of the tests, the practitioner diagnoses TB based on the results. It is important to inform the patient that tuberculosis is a curable disease and the patient has nothing to worry about. The practitioner then informs them about the duration of treatment, which is 6 to 8 months, reinforcing that the treatment is available free of cost at both government and certain private TB care centers. The patient is referred to a TB healthcare worker available at the private TB care center. The doctor provides details regarding the patient for notification to the government system. The private TB care center is a space provided by a private hospital or clinic which acts as a hub for TB services. The private practitioners practicing in the clinics or hospitals near this center can also refer TB symptomatics to this center. The private practitioners have the option of availing diagnostic and treatment services from the center while at the same time retaining their patients. Once the patient meets the TB healthcare worker, they inform him about the treatment process. The healthcare worker facilitates identification of a treatment supporter who will ensure regular intake of medicines. The healthcare worker counsels the patient and motivates the patient to complete the treatment. The healthcare worker does a risk assessment, individual and family counseling, and if necessary, provides monthly nutritional support to the patient throughout the duration of the treatment. The healthcare worker also informs the patient about the importance of screening their family members for TB. The patient is reminded at regular intervals for follow-up visits with the doctor. The doctor reiterates to the patient that he has to take the treatment for 6 to 8 months. At the end of the treatment, the doctor asks the patient to undergo the necessary investigations and declares the patient cured. Private health sector response is critical to end TB. So let's join hands, save lives, end TB.